Hello, my name is Parth Borker, and welcome to the fourth episode of the Health Policy Podcast series. Today we will be discussing mental health and mental health advocacy, and specifically how they relate to high schoolers. Mental health has affected us all, whether it be first-hand experience or knowing someone who has a mental illness. And depression, suicidal thoughts, and all other mental illnesses must be taken seriously. So I would like to start off this episode by saying, if you or anyone you know is thinking about self-harm, please seek help from a friend, family member, or any trusted person. Joining us today to help speak on this topic is Mr. Christopher Yamada. Mr. Yamada is a student at Raiyaan University and has developed a keen interest in mental health.
Thanks for having me on the podcast today, guys. I think this is a pretty interesting topic to talk about. Just for the listeners out there, my name is Christopher Yamada, and as Parth had already said, I'm a medical student at Raiyaan University who's developed kind of an interest in mental health over the years. So, thank you for bringing me on to talk about it.
Of course. Great. All right. So I want to start off by asking, how would you define what a mental health disease or illness is?
So that's a very interesting question. There's two ways to or multiple ways to think about it. Clinically, psychiatrists and mental health professionals can see mental health disease as a set of defined criteria. So a patient would be considered to have a mental health illness based on these criteria and whether or not they meet them. This can actually be established in something called the Diagnostic and Statistical Manual. Some people know it as like the DSM-5 criteria. So, for example, major depressive disorder. In the DSM-5, it says that a patient has to have 5 out of 9 symptoms, and of those 5, 1 has to at least be, someone having a depressed mood, or they've recently felt a loss of like pleasure in activities that they usually normally take interest in. It's also called anhedonia, which is the medical term for it, if that's what you would say. Another way I guess you could think about it is anything that you feel has impacted your life in terms of thoughts, behaviors that have become intrusive and have somewhat impacted you in the way that it now distracts you from your regular activity or your day-to-day living. So, normally I guess it's a change from your normal baseline.
So what are some of the most common mental health diseases that people suffer from, especially teenagers and high schoolers, since that's what we're mainly focusing on today?
Mm-hmm. Regarding mental health, the most common diseases, I think, in the United States specifically, have tend to been anxiety disorders. Statistically, about 20% of the total U.S. adult population has experienced a form of anxiety or anxiety disorder in the past year. And, based off of statistics, about 31% of all U.S. adults have kind of demonstrated a lifetime prevalence of an anxiety disorder. That kind of includes, it's more of a catch-all term or like a category. So anxiety disorders can refer to one most commonly known as generalized anxiety disorder. Obsessive compulsive disorder is another one. PTSD, panic disorders, social phobias, and social anxiety disorders. And I think this kind of carries on more specifically to teenagers and adolescents. Specifically speaking about teenagers, adolescents, mental health is also very common in that population as well. About 1 in 5 from the age of 9 to 17 have been considered to have a diagnosable mental health disorder. Suicide is actually one of the top 5 leading causes of death in teenagers at that age, from 12 to 19. And among all mental health disorders, teenagers, also experience anxiety disorders kind of at the same rate as the adult population. There's an estimated about 31.9% of all adolescents have had an anxiety disorder. Besides anxiety disorders, you might have heard like ADHD is very common. Mood disorders like depression or variants of depression, and then something called disruptive behavior disorders, things like that.
31% of adolescents, that's a lot. That's very surprising, actually.
Yeah, definitely. When I was tried to double check the statistics on it. I was caught off guard by it as well because, I feel like today's society, mental health has become kind of pushed to the forefront.
Right.
People are more accepting of it. Public awareness is growing as well. But yeah, that was definitely something that caught my eye as well.
So you spoke a little bit about anxiety. So how do professionals kind of differentiate between, say, like being anxious before a test versus clinically having an anxiety disorder?
Mm-hmm. So this kind of refers back to what I was saying before about the DSM-5 criteria. There are specific criteria that physicians and psychiatrists will use to classify someone between just, having anxious symptoms and having an actual illness that would be categorized as anxiety or generalized anxiety disorder. For instance, one of them, I believe, and may want to double check this, I might be right on about it, but for generalized anxiety disorder, specifically, you need to have kind of symptoms that persist. And for generalized anxiety disorder, I believe it's about 6 months of these symptoms to the point where it kind of is intrusive to your daily life. That's another thing, is if you've had these pervasive thoughts of anxiety to the point where you cannot function and carry out your day-to-day activities, that's when it kind of transforms from just general symptoms to an illness. And that's just only one form, I would say. So, generalized anxiety, the criteria has been kind of defined via through the amount of time, whereas, as I had said before, regarding like major depressive disorder, I believe the symptoms need to have persisted for about 2 weeks. So that's the kind of chronological time duration. But regarding the actual symptoms, it kind of varies between each other. So sorry, I'm kind of jumping between like anxiety and mood disorders. But with major depressive disorder, I don't know if have you heard of like SIGI caps? They kind of refer to that when they're talking about major depressive disorder. Yes. So SIGI caps is about like 9 symptoms right there that are used as like a defining criteria to see whether or not someone would be considered to have major depressive disorder. And you'll see if they have like 5 out of 9 of them and it's pervasive, it's affecting their daily life. I think that's when you would kind of go from, okay, this individual is having depressed symptoms versus this person is suffering from major depression.
So what groups of people are kind of most vulnerable to having these mental illnesses, and how can these groups of people somehow curb or prevent not only gaining this mental illness, but also like having it affect their daily lives?
Regarding the groups of people that are most vulnerable, that's kind of a tricky question, I would say. I think there are some common factors, one being low socioeconomic status. If you are coming from a family that lacks financial resources, one could imagine that they will be dealing with a lot of day-to-day struggles that someone more well-off would be able to handle or be able to address. On top of that, you'd have to consider someone who also has a family history of mental illness. It's often more common to see various mental health illnesses in I guess children of individuals who've had mental health issues themselves. With that being said, there's like a variety of different risk factors that people could undergo with low socioeconomic status. On top of that, there are other risk factors that people would also have to deal with. Besides someone who has, comes from a difficult background, that can kind of lead to someone who has like a lack of a strong support system, not only with a family, but just overall, like, the community. There's people who are growing up in difficult households, a lot of traumatic experiences with that, and difficult childhoods in particular can contribute to individuals who will develop mental health issues later down the lines, and that can refer to childhood neglect, abuse, things such as that, things in that matter.
Right.
Mm-hmm. And then ways to prevent it, because some of these issues are somewhat difficult to address on an individual level. There are various things that people can do. I think on a population level, stronger community, increased access to support and other mental health care resources. Specifically, I guess talking within a household, early interventions would be could help a lot. Talking to younger children at a younger age and helping them receive care, receive support for certain mental health struggles they may be going through would benefit greatly, because down the line, a lot of these mental health issues that start at a young age can carry over into adolescence and then carries over into adulthood. So, early targeting, providing them with early resources and access to those resources, I think would help a lot.